I can confirm that the scene is safe. Hello Kamala, my name is Jamie and I'm your nurse for today. I will administer your insulin today. Is that alright? Okay. Have you eaten already, Kamala? And do you know your latest blood sugar levels? Before I proceed, I will just check some details. Is that alright? Okay. Your full name is Kamala Gurung. Your address is 14 Penzance Mount, Reading. Postcode RG14FX. Date of birth 30th of the 12th, 1980. And you are allergic to strawberry. I confirm that I have the right patient. Now I will prepare the equipments. Prescription chart for Kamala Gurung. Address 14 Penzance Mount, Reading. Postcode RG14FX. Date of birth 30th of the 12th, 1980. Allergic to strawberry. Medication, insulin glargine. Dose 10 units. Date and time today at 8 o'clock. Prescriber Dr. June, GP. Signature of doctor and date today is present. I can confirm that the prescription chart is complete, signed and dated and is due my time. I'm happy to proceed. I will now prepare my equipments. My sharps bin, it is not full and I'm happy to use this one. My Safety Glide insulin syringe. Packaging is dry and intact. Expiration date is 2024. Happy to use. My alcohol swab. Packaging is dry and intact. Expiration date is 2023. Happy to use. My insulin glargine. Packaging is dry and intact. There are no precipitates and this is 100 units per ml. Expiration date is 2029. Happy to use. My gauze, packaging is dry and intact. Expiration date is 2025. I'm happy to use. I will now clean my vial. I will clean it for 30 seconds. 1, 2, 3, 4, 5. And I will allow it to air dry for another 30 seconds. 1, 2, 3, 4, 5. Now my equipment, Kamala. Are you happy to proceed? Kamala, I will just assess the site. I can see that the skin is clean, no signs of infection, no signs of skin lesions and surgeries, so I'm happy to proceed. I will now clean the site for 30 seconds. 1, 2, 3, 4, 5. And allow it to air dry for another 30 seconds. 1, 2, 3, 4, 5. I will now pinch the skin and I'm gonna insert the needle in a 90-degree angle. Then I'm gonna administer the drug slowly over 10 to 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm gonna withdraw the needle rapidly. We are now done with the procedure, Kamala. Do you have any questions? Okay, are you comfortable at the moment? All right, I will do my documentation.